Okay, as promised, I was going to make a quick video on our Adpie Notes. We are no longer going to be using the Fort Notes, and one thing you are going to notice is that the Adpie Notes are quite longer. They're a little bit more extensive, which is how they're supposed to be. And in the real world, you're going to have probably, condensed templates, and you might be able to do a lot of clicking. But in an educational setting, we want to make sure that each student understands the process of care and that we're really critically thinking through the appointment from the time that we see our patient till the time that we dismiss our patient. So when you're in your notes, you're going to go ahead and click Adpie Notes. And here they are. So let's go through each one so you kind of know what the expectation is. So for the visit, what is the patient presenting for? Are they presenting for a cleaning? Are they presenting with, a toothache? So we'll just say they're presenting for a cleaning. And, are they here for recare status, and are they on time or overdue? Now, you may not know this, especially if they're a new patient. So, if you know the recall, you can go ahead and put it in here. And if you know how many months they're overdue, you can go ahead and put that in there too. For their chief complaint, okay, so this is a problem. This is the problem that the patient presents with, all right? And so if a patient comes to you with a problem, we need to be asking the symptoms, the tooth number, have your patient point to the tooth. Where's the location, the duration of the problem? Is it, so collect as much information as possible so that when you have that information, you can bring that to the dentist with a full picture of what this patient is experiencing. Now, and then also, whatever the patient says, make sure you put this in quotations. Now, let's just say the patient doesn't have a chief complaint. That's okay. Delete all this and write none. Okay. For assessment, you're going to put your blood pressure here, your pulse here, and your respirations. Medical history reviewed. Did you review it? Okay. Well, hopefully you did, right? If you did, then we're just going to put in yes. For A1C, if there is an A1C, put it in there. If not, we're going to put NA. For medications, if you reviewed the medications and they're all current, you can just say see origin. Same thing with dental considerations. This helps a little bit with the redundancy, but we have to have it in the notes that we reviewed it. Same with allergies. We can say see origin. Last dental exam, maybe the patient knows, maybe they don't know. If they don't know, you can just write unknown. If we do know, you can go ahead and put the year in. Yeah, well, the whole date, hopefully. Dietary significance. This one is kind of think about back to your nutritional counseling. Ask your patient, what is, your favorite food? What do you like to drink during the day? Do you have a sweet tooth? This gives you a better understanding of things that you may or may not want to modify when you're talking about your oral hygiene instructions. So definitely talk to them about their dietary significance, which is huge when it comes to Canberra, right? All right. The extraoral and the intraoral. The findings. This area is only for anything that is abnormal, okay? So anything that's abnormal. So let's say they have a lymph node that is inflamed, or maybe an enlarged thyroid, or maybe they have a lesion, on their tongue or on their cheek. So anything that's abnormal. If everything is within normal limits, then, or non-significant findings, we can just say see origin. Okay? But anything abnormal has to be documented in this area. For gingival description, that does need to be in here. Make sure that you are documenting the color, the contour, consistency, texture, and size. These just give the examples. So once you've done that, you can, you don't have to keep this in here. So once you do the color, the contour, consistency, you can just go ahead and write it in here. Stippled. Nope, not stippled because it's red. So probably spongy, smooth and shiny, slightly bulbous. So whatever you want to write, okay? But make sure that you have all of them there. And then for hard tissue, this is where we want you to document the actual tooth numbers, okay? So maybe it is demineralization on 2 and number 3 and number 4, maybe dysplasia on 8 and 9, abrasion, maybe they don't have anything, so non-significant findings, or NA, abfraction, non-significant findings, erosion, NSF, and then attrition, maybe 6 through 11. Okay. Deposit level, this is where you're going to determine whether what the deposit level is, whether it's a 1, 2, 3, or 4. You can delete these and you can just put the level. For x-rays, all right, date of last set of x-rays. This is important because it tells us whether or not we're going to be taking x-rays today. All right. Total number of x-rays taken. This is important because if there's any retakes, so if we're taking a series of, 4 bite wings and there's 2 x-rays that were, retakes, we're going to actually put 6 here. And if there was, 2 retakes because they were non-diagnostic, it would be 2, which would make sense because 6 minus 2 equals 4. And we took 4 bite wings. All right. Radiographic bone loss. You need to be looking at your x-rays and determining is there any radiographic bone loss? And if there is, you have to determine what percentage do you feel that the patient has radiographic bone loss. Is it 10%? Is it 15%? Is it 50%? So you have to look at the x-rays to ask yourself, is there radiographic bone loss? Because if there is radiographic bone loss, then you have to grade and stage. If there is no bone loss, then we do not grade and stage, and the patient then is considered healthy or has gingivitis. So you need to be looking at the x-rays to determine what percentage of bone loss, if any, is there. And then you can kind of look a little further. Is it generalized or is it localized? Your findings, this is going to be, are you seeing anything on the x-rays that is significant? Is there a class 3 furcation or a class 4 furcation? Is there a radiolucency on, tooth number 12? Is there any overhangs? Is there any suspects? So anything in this area of findings is considered abnormal with the teeth. Then we're going to diagnose, is this patient healthy, gingivitis, or periodontitis? Now, we already know that we are going to be grading and staging if there's radiographic bone loss, but we still don't know if the patient is considered periodontally involved or not, right? Because we have to still do our probing. And so we know that bone loss can happen from grinding and clenching. It can happen from orthodontia therapy or orthodontic therapy, and it can also happen from just age, right? So once we determine whether or not the patient is, if they have bone loss, then we look at the probing depths and the bleeding to determine if this patient is healthy in a reduced periodontium or do they have periodontitis. And then we would put the grade and stage here. Your modifiers is going to be your diabetes or tobacco. If there is, you put it in there. If not, you can just write NA. Pocket depths, generalized. We just kind of want to get a generalization of what the pockets are. Are they 3 to 4 millimeters? Are they 5 to 7 millimeters? Are they 5 to 8 millimeters? And, the bleeding on probing, is it slight? Is it heavy? Is it sporadic? Is it delayed? Is it, is it spontaneous? And is it localized or is it generalized? So you can put a little bit more, thought process into looking at your probing depths that way. Same with recession. Look at the recession. If there's a couple teeth with recession, go ahead and document them. You can also say generalized throughout, generalized between 1 to 3 millimeters or 1 to 2 millimeters, whatever that probing sheet is. So you're really interpreting the probing sheet into this. You do the same thing with clinical attachment level and furcation involvement. Okay, let's jump down to your oral hygiene assessment. Okay, overall, do you think that the patient's home status is poor, fair, or good? Whatever you choose, you can delete all of this and put that. Patient habits. This is really important. Everything in italics is giving you some ideas, okay, of what to ask the patient, right? Tell me about your brushing. Tell me about how do you clean in between your teeth? Are you using any mouthwash? If so, what kind? If you're a cleanser or grinder, are you using a mouthwash? Do you use an electric toothbrush or a manual toothbrush? Are you using string floss or are you using a floss pick? Do you tongue scrape? So asking these open-ended motivational interviewing questions gives you a better understanding of how you want to present your oral hygiene to your patient. You can't thoroughly individualize treatment for your patient unless you understand their patient habits at home. So please take some time to understand this with your patient, okay? For the risk assessment, this is your Canberra. Are they low, moderate, or high? Okay. Rationale. Why did you put that at high? Sips on Mountain Dew all day long. Oofda. Now that is some high caries risk for you. All right. So why are they at a high caries risk or why are they at a moderate risk? Okay. Your dental hygiene diagnosis. All right, you guys all got a laminated part for this, all right? So this is determined by your assessment. I'm not going to go too further into this because I already put a video out for you guys understanding your DHD diagnosis. So make sure that you have that in there. Then care planning, okay? What are you treatment planning, okay? So, whoops. So your treatment planning, UCDT codes, okay? So today we are going to recommend doing a comprehensive cleaning. We're going to clean their teeth. We're going to do oral hygiene instructions. We're going to take some x-rays and we are going to do some fluoride, okay? So right down here, it's the rationale. Why am I doing that treatment? Okay, there's always has to be a why, right? You can't just do a treatment to do a treatment. You need to know or explain why are you doing this treatment on this patient, okay? So you're doing a comprehensive exam because it's been more than a year since they've seen a dentist. We're doing a cleaning because the patient needs a routine prophylaxis. We're doing oral hygiene instructions to educate the patient. We're doing 4 bite wings because they're due. It's been over a year since their last x-rays. And we're doing fluoride because they're a high caries risk. Say you're doing, NSPT 4341. Why are you doing it? Why are you recommending to do non-surgical periodontal therapy? Okay, so that's the rationale to what treatment you're recommending. So instrumentation and preventative measures, your PI score, you already know how to document that from your perio sheet. Overall, is the calculus slight, moderate, or heavy? Is it generalized or localized? What instruments did you use? Did you use the Cavitron? Did you use your hand instruments? Did you do polishing? Yes or no? I'm not super pleased that we have selective polishing. We do not recognize selective polishing, so I would like to delete this. I don't know how easy that's going to be, but let's get rid of it. And polishing, yes. What kind of prophy paste did you use? What was the abrasiveness? Was it fine? Was it medium? Was it coarse? Did you provide oral hygiene instructions? Yes or no? What did you talk about? Did you talk about brushing? Did you talk about flossing? Did you talk about the role of bacteria? Did you talk about what gingivitis is or what periodontal disease is? Did you talk about diet? Does the patient have any goals? So this is where a lot of like the meat of your notes come from, where we're really individualizing this for the patient. So implementation. So I know this gets a little crazy. Delete whatever you did not do. Okay. So if you saw a patient, an adult patient, let's delete this. Was the patient scaling in the gingiva? Nope, we didn't do that. We didn't do that. We didn't do that. We didn't do a rest-in. Okay, but we did the prophy. We did 4 bite wings. So I'm going to delete all of this. We did fluoride and we did OHI. Okay, so that's what we did. How did the patient respond to treatment? Stable, fair, or poor? Pick one. Delete the rest. Okay. Patient was stable. Explain. I mean, if the patient was stable, there's nothing to explain. But if it was poor or fair, you might want an explanation for that. Patient understanding of OHI. How did your patient respond to it? Did they seem like they understood that it was all good, or do you feel like that there's going to be some more reinforcements? Evaluation of treatment outcomes. This one will happen as you see patients. It may be, a to be determined situation, but say you saw a patient 2 weeks ago and you did NSPT on quad 1. Okay. Well, you're going to evaluate that treatment. How does the gum tissue look? Is the patient experiencing any sensitivity? How is their brushing and flossing? How is their plaque control up there? Any post-op instructions? Okay, so remember, I have all of these printed out for you guys in that black cabinet, but what are the post-op instructions you gave to the patient regarding fluoride? Were there any post-op instructions when it came to giving the patient local anesthetic or for non-surgical periodontal therapy? Okay, so what post-op did you give them? Now, was the patient special needs? Yes or no? Okay, this is on your grade sheet too. If the patient was special needs, go ahead and write no, and you can just delete all this. But if the patient was special needs, then you're going to have to write in yes. And then how did you accommodate the appointment? Okay. Faculty verification. We will write in here that, or you will, that, who was the dentist? What dentist did your exam? And the findings by examining the dentist. So we're going to have 2 dentists there. It's probably going to be Dr. Lefevre's for both. Your next recall or your next visit, UCDT. Okay. What do you want to see them for? Is it going to be a 4341? Is it going to be a 1110? And then is there a recall? Are you putting the patient on a recall? Any referrals? Are we referring them to DMD? And if so, specify why. Is it for restorative work? Is it for a night guard? Is it for, an appliance? So anything that we're referring for, we want to be as specific as possible in that line. And then down here, you're going to write your name, and then your instructor will write their name, and then we're going to save the notes. So again, I know it seems like a lot. It's complex. You can fill this out as you are treating your patient. Absolutely. It's a great way to, make sure that you're crossing your T's and dotting your I's. And I know it's a lot, but I promise that there is a reason why we're doing this. And it's just to make us all more aware of what this patient has to offer and what we can do to provide the best care for this patient. Thanks.